You're called to the emergency department to see a 72-year-old male with a scalp laceration after a fall. After examining him, you find out that he's been falling more frequently, has balance issues, and has some numbness and tingling in his hands. He says that his grip feels weak and he's been dropping things more often over the last 6 months, and he has some clumsiness with buttoning up a shirt. What's your next step in the assessment? I'm Dr. Rachel Peterson. I'm a neurosurgeon. Let's talk through the steps of this case together. So most likely you're going to have some imaging of the head because of the fall with the head injury. That's clear. Now, the symptoms that this patient is presenting with: increased frequency of falls, balance issues, sensory deficits in the hands, and grip weakness should clue you into a condition called cervical myelopathy. Cervical myelopathy is a condition where the spinal cord in the neck gets compressed, usually by severe degenerative disease that involves disc herniation and osteophyte formation. When this happens, oftentimes on the MRI, we can see increased T2 signal within the spinal cord at the area of the injury. Neck pain and radiculopathy are actually rare symptoms of myelopathy. More frequently, patients will complain of numbness and tingling in the hands or arms, weakness in the hands, balance issues, generalized weakness in the legs, and increased fall frequency. Sometimes this can confuse the workup and cause practitioners to look for sources within the head or the lumbar spine. Always remember to scan the neck in these cases. If an area of severe stenosis in the neck is encountered, surgery may be recommended for this. This can be done by an anterior cervical discectomy infusion or a larger posterior decompression infusion if it's more severe. Following a cervical decompression, symptoms like pain are usually the first to improve. Weakness improves after several months with physical therapy, but numbness and tingling may linger on for quite some time. The main goal of doing surgery in these cases is to prevent any further damage to the spinal cord. I always counsel my patients not to expect to be immediately better following the surgery, and that they will still need to engage with physical and occupational therapy in order to see improvements after the decompression. If you're experiencing any of these symptoms, it's important to see a healthcare professional. And remember, students, if you come across someone with these symptoms, think about the neck.